Hello, I'm Dr. Ann White. We're broadcasting live today from Carolina Laser and Cosmetic Center here in Winston-Salem, North Carolina. And today we're demonstrating Kybella. Kybella is deoxycholic acid, and it's a naturally occurring substance in the body that helps us to digest fat. When it's used in the submental area, it helps to disrupt fat cells permanently so they can't hold fat anymore. So Angela, one of my nurses, has graciously volunteered to be our model for today's demonstration. We're going to start first by numbing her in the submental, or the area under the chin area. So let's get started. Shane, can you get someone to help me with the Zimmer chiller, please? We're going to blow a little cold air on her neck to make it more palatable and comfortable for her as we do the injection. Let's have a little Zimmer, Samantha. Okay. Call our Zimmer chiller Mr. Big Chill, and ladies have threatened to go home with it. It's great for menopause or a hot summer day. So we're just going to inject a little bit of numbing. Someone asked a question about if we do topical numbing. But instead of doing topical numbing, we go straight for the injectable numbing. It works more effectively, and our patients like it better. Because Kybella, are you doing okay?
Yes.
Okay. Because Kybella is acidic, without the numbing, it would burn. So in our office, we try to make our patients comfortable no matter what. We do a lot of tattoo removal in this office. A lot of people who do tattoo removal just do the laser procedure without any numbing. But we also do injectable numbing for tattoo removal. Our new Botox patients, sometimes we do a little bit of topical numbing, but a lot of those go without any anesthesia at all because I use a tiny little needle. How's that feeling? And the cold air provides some anesthesia as well. Let's dosey-dose, Samantha. Come this way?
Yeah.
This way.
Okay. There we go.
We have mini lasers. We have mini lasers in this office. Okay, turn this way. Other way, darling. This is just a little alcohol to clean her off.
Dr. White, tell us a little bit about the dots on her neck. What are those?
So it's a grid pattern, and the company developed it to guide injectors in the pattern that's most efficient in injecting. And if you notice, it avoids this gel area, which is where the nerve, that marginal branch of the mandibular nerve runs. If it does, and it does in 20% of people, it goes below the jawline. It'll usually be in this area. So we avoid that area altogether.
Why red and black?
Help me keep track of where I've been and haven't been. So when I'm injecting the Kybella, I think red robe, blue robe. If they were all the same color, it might get kind of confusing. You might forget where you've been.
And how long does a typical Kybella procedure take?
The numbing here takes a few minutes, and then the injection of the Kybella takes a few minutes, so maybe 10-15 minutes. You got a little bit more, Samantha? Not very long. We'll show you. Post-op, some people get a little bit of swelling, like we discussed earlier. They can last for a few weeks. Some people get a little bit of numbness as well. In our practice, we've never had any trouble with getting that nerve.
And how long have you been administering Kybella, Dr. White?
It was FDA approved in April 2015, and shortly after that, we started injecting as soon as it was FDA approved. We've done about 4,500 cases I think about 4,500 patients nationally have been injected. I'm not sure how many we've done, but over 100 or 200, in the hundreds, maybe 1,000, but I don't think so. We're in the hundreds.
Perfect.
Okay, so I'm just going to pinch the skin a little bit here, Angela. Are you holding your own zimmer there?
Yes.
Hold it, good girl?
Yes.
Okay, so she's actually drawn these up so that we have 24 units in each little syringe, and we're doing 8 units per site.
So you're actually doing the Kybella procedure now?
Yes. How was that? I am. So I like to pinch the skin a little bit. How's that, Angela?
I don't feel anything.
And you just inject. Now, I do not inject directly into the dot. Does anybody know why I might not do that? Because if you do, you could tattoo the patient.
Yeah.
Yes. So I go beside the dot, but not into the dot. And then we tell our patients if they need to rub afterwards, to rub up and not down, because we don't want any diffusion into the thyroid gland, which sits like a butterfly in front of the neck there. So now I'm thinking blue dot. So if you think as you're injecting it would be pretty easy to get lost if you didn't have the different color dots. Someone was clever in inventing those dots, weren't they?
And about how long until they see results?
Usually 2 months.
Okay.
So we'll see Angela back in 2 months, and we'll decide then if she needs more or not. Probably she'll need more.
And what will she see directly after the procedure?
She might see a little bit of swelling, because how many cc's of numbing did we inject there, Samantha? Okay, so she's got 10 cc's plus the Kybella. And what is each vial of Kybella, Samantha? 2 cc's?
Yes.
Can I have another? So you said 8 cc's, we got 8 cc's of the numbing, you said, right, Samantha?
10 cc's of that.
Okay, so I'm on the blue row now. So there's 10 plus 18 cc's in her neck, that has to be resorbed. So more numbing than product, actually. Which you could cover up, I would think, with a turtleneck or a scarf for a few weeks.
It's good weather for that right now.
Yeah, it is.
You could have gone outside instead of using
Good scarf weather, I know,
That's
right?
right. So who knows how cold it's gonna. What's the minimum temperature today?
I think
20 something.
22. Oh, tonight? Well, that's what it was this morning. Oh.
How cold? Tonight is how cold?
in the teens.
Oh my goodness, so you could just go outside and cool your neck down, no trouble.
How are you feeling, Angela?
Good. I don't feel anything, actually.
That's what we want to hear. Okay, good luck. We're done.
Wow.
How was that? Not too bad?
No, that wasn't bad at all.
Okay, so Samantha's going to just wipe over those dots, and Angela can go about her way.
And you said that some patients need to maybe move the area, or is that recommended or not?
We don't want them to rub down into the thyroid gland. So if they have to rub their neck, you know, frequently when I do lip augmentation injections, lip injections, patient, regardless of if we say don't touch your lips, they're still going to want to touch your lips. It never fails. So the best thing is to educate them if they have to touch your neck about how to touch your neck. So if she has to touch her neck, we'd rather her not touch it at all, but she's going to need to wash it tomorrow or the next day. Better to wash up than down.
Perfect.
At least for a day or two. Because we don't want any infusion into the thyroid gland. And she's done.
All right, great.
So thank you for joining us, and we'll have another session soon of another procedure. And we'd be happy to see you here in the office anytime at Carolina Laser in Winston-Salem.
Perfect.